Scientists are shocked. This one simple exercise helps restore blood vessels naturally, and almost no one is talking about it. If you've had COVID, or even if you haven't, your blood vessels may already be suffering. Today, I'm going to show you a fast, simple, and free method you can do at home to support vascular health. This topic has been studied by many medical professionals around the world. Researchers such as Robert F. Furchgott, who helped uncover the role of nitric oxide in blood vessels, Luis J. Ignaro, and Salvador Moncada, have shown how critical the endothelial lining is for circulation, oxygen delivery, and overall cardiovascular health. Their work, along with many post-viral vascular studies, helps us better understand why supporting blood vessels has become so important today. This topic is especially important in the post-COVID era, because today vascular problems are no longer only about cholesterol or fat metabolism. What we are seeing now is something very different. For decades, we believed vascular disease was mainly about fats and plaques. But recent observations show the real problem is often the endothelium, the inner lining of your blood vessels. Think of your blood vessels like flexible pipes. When the inner lining is healthy, blood flows smoothly. When it's damaged, everything slows down, stiffens, and suffers. Viral infections, especially COVID, can severely damage this lining, not only from the outside, but from the inside as well. Your quality of life depends on three things: how fast blood moves through your vessels, the quality of that blood, and whether blood actually reaches the organs that need it most. First, your brain. Without proper blood flow, brain health is impossible. Second, your detox organs, the liver and kidneys. Third, your metabolism and energy. If you've experienced brain fog, constant fatigue, or shortness of breath after COVID, this is not random. In clinical practice, we discovered something critical. You can influence vascular health without medication, using the body's own mechanisms. The key is short-term breath holding combined with muscular tension. Simple, safe, accessible. This single exercise works on 3 vascular levels at once: vascular elasticity, vascular tone, and vascular structure. It activates the superior vena cava and the inferior vena cava, and directly influences diaphragmatic circulation. This improves blood return to the heart, oxygen delivery, and breathing efficiency. That's why so many people after COVID feel like they're gasping for air. They breathe more, but receive less oxygen. Low oxygen doesn't just affect breathing. It triggers a chain reaction. Liver detoxification weakens. Kidney filtration declines. Metabolic balance is disrupted. Blood markers begin to change. ALT rises. AST rises. The atherogenic index increases not because of fats, but because detoxification fails. Mitochondria stop producing enough ADP. Muscles weaken. Tendons and ligaments overcompensate. This is why people feel exhausted even after resting. Fatigue is not laziness. Fatigue is vascular failure at the cellular level. Now we arrive at the most dangerous part, the brain. The brain consumes more oxygen than any other organ. When blood quality drops, the brain suffers first. Free radicals enter the bloodstream. They pass through the intestinal barrier. They reach cerebral vessels. Vascular tone changes. Elasticity is lost. Structural stability weakens. This explains the rise in cerebral aneurysms, neurological disorders, and severe cognitive symptoms in the post-COVID period. What is most alarming is what we are seeing in children. Children as young as 3 to 5 years old experiencing myocardial infarctions, pulmonary infarctions in early childhood, cardiovascular dysfunction in teenagers. Heart valves are damaged, mitral, tricuspid, aortic. As detoxification fails, blood becomes aggressive, and valves suffer first. The heart enlarges. Left ventricular dilation appears. At 13 to 15 years old, we now see hearts resembling those of elderly patients. These were once considered age-related problems. Today, they are systemic consequences. And yet, there is hope. This process is reversible. When blood purification improves, when free radicals are reduced, when vascular tone and elasticity are restored, the entire cardiovascular system stabilizes. Energy returns. Mitochondria recover. ADP production resumes. Muscles regain strength. Ligaments stop overcompensating. Psycho-emotional stability improves. Energy is not motivation. Energy is physiology. Let's connect everything. Viral damage affects the endothelium. Endothelial damage disrupts blood flow. Poor blood flow reduces oxygen delivery. Low oxygen weakens detoxification. Detox failure increases free radicals. Free radicals destroy vascular structure. This is not aging. This is systemic vascular stress. Today, atherosclerosis is no longer the main enemy. The real enemy is fibrosis, loss of elasticity, and structural breakdown. No medication can replace movement, breath, and pressure. That's why we invite you to our Authors Sunday webinar. You will learn how to restore vascular elasticity naturally, how to improve blood purification, how to support liver function and digestion, how to reduce free radicals through simple nutrition, and how to adapt these methods to any age. No extreme diets, no expensive supplements, no complicated routines. You can do this at home. You can start immediately. The link is below this video. Remember this: health is not about fighting symptoms. Health is about restoring systems. Your blood vessels feed every cell. When they suffer, everything suffers. When they recover, the body recovers. Do the exercise today. Just 5 seconds. Feel the difference in your breathing. If this information was valuable, like this video. Share it with someone who needs it. And join us on Sunday. Stay healthy and take care of your blood vessels.